So my name is Stefania Cruz, and I am doing my patient teaching video for Nursing 215. So the doctor has prescribed some new medications for you to start taking. We are just going to go over those medications, and we're also going to go over the medications that you're already taking at home just to make sure you fully understand them. So the first medications we're going to go over are the ones that you're already on. So the first medication is Synthroid. Currently, you are prescribed 100 micrograms once daily. This medication helps keep the right amount of thyroid hormones in your body. The thyroid helps with energy, weight, and mood. So you need to make sure you're taking this medication on an empty stomach with a full glass of water. After you take the medication, you need to make sure you're not eating or drinking anything besides water for the next 30 to 60 minutes, as it can alter the medication. You need to make sure you're taking this medication at the same time every day and as prescribed by the doctor, which is once daily. This medication can take several weeks of you taking before you actually feel the effects of it. You will also need to continue to do a routine lab work as ordered by your doctor to make sure that you're staying at the appropriate levels. Some side effects that you do need to notify your doctor if you have any, including feeling shaking, having a fast heartbeat, a sudden change in weight, which include a gain or a loss. You need to notify your doctor immediately if you have any of these. So the next medication we're going to discuss that you are already taking also is Protonix, which you are currently prescribed 40 milligrams once daily at home. So Protonix helps reduce the amount of acid in your stomach. Having too much acid in the stomach can cause that chest pain right in the center. So you need to make sure you're taking the medication before you eat, about 30 to 60 minutes before. And you also need to take it as prescribed by the doctor once daily. You do not want to crush, split, or chew this medication, as it does have like a protective coat around it. And when you do that, you'll mess up the coat and it's going to absorb differently in the body. You need to try to take this medication at the same time every day. You also need to avoid foods that can cause your heartburn to feel worse, which can include caffeine, coffee, spicy food, or any other triggers that you might be aware of that you have. If you are having any trouble swallowing or having black or bloody stools or chest pain that has no relief, you need to notify your doctor immediately, as it can be something else is wrong. So the next medication is a new medication for you that we're going to review, and it is called Lopressor. So the doctor prescribed you 50 milligrams once daily. So this medication helps your heart by slowing down your heart rate, which will in turn lower your blood pressure. You need to take this medication with food or immediately after you eat. You need to try to take this medication at the same time every day. You do not want to suddenly stop taking this medication though, as it can cause a rebound effect on your blood pressure and actually cause more damage. When you first start taking this medication, you may get dizzy, tired, or lightheaded, and this will generally get better after a couple of days. When you are going from a sitting to a standing, or like a lying to a sitting, you need to get up slowly and take your time and allow your body to adjust between each position. You need to also check your blood pressure and pulse before you take the medication or as ordered by your doctor. You need to notify your doctor though if your heart rate gets below 60, you start to have shortness of breath, or you have swelling in your legs or arms. So the next medication we are going to discuss is another new one for you. It is called Zestril, which will help with your heart and your diabetes. So this medication allows your heart to pump more easier, the blood more easy, and then allows in return, which will lower your blood pressure, and it also helps protect your kidneys. So diabetes, which is a new diagnosis for you, puts a strain on the kidneys, and this just helps protect them and allow your kidneys to function more better. So you need to take this medication on the same time every single day, once daily, as prescribed by your doctor. You can take this medication with or without food. Like the Lopressor, you may feel dizzy, lightheaded, but again, this should improve after a couple days. You need to make sure you drink plenty of water and avoid high salt foods. If you do have any trouble with swelling or low blood pressure when you check your blood pressure, or you have a change in urination, so like you're peeing a smaller amount, it's darker or just doesn't feel right, you need to notify your doctor. For whatever you drink in, you need to make sure you're peeing out. That's a good rule of thumb. So the last medication we are going to discuss, which is also new for you, is metformin. Metformin is used to help treat your diabetes, which is a new diagnosis for you. Your doctor ordered you to take this once daily, and you need to take it with food. You need to try taking it at the same time every day. You need to make sure you're not skipping any meals. You need to make sure you're eating throughout the day, and healthy meals, not just chocolate, junk food. Your doctor will order you routine lab work on you to monitor your blood sugars. If you are having a procedure or you're getting any dental work, you need to make sure that they are aware that you're on metformin, as it can mess with anesthesia. You also may have an upset stomach for a week or two, but this will generally improve. If it does not, though, you do need to notify your doctor so they can adjust your dose. If you are having any symptoms of low blood sugar, which can include sweating, shakiness, confusion, you need to eat something with sugar right away. This can include little pieces of candy. It can include like the Lifesavers, orange juice, crackers, peanut butter, anything with a little sugar you just need to eat to get your blood sugar back up. Remember, you do not want to stop taking any of your medications or adjusting the doses yourself without talking to your doctor. You also do not want to start taking any supplements without talking to your doctor, as these can affect the medications.